following public service announcement is being brought to you by
Kyle,
Lindsay,
Megan,
Colleen,
Jade, Gabby,
Dolger.
and I'm Lauren.
Medical surgical units in the hospital can have upwards of 80% of patients assessed as at risk for falls at any given time, according to standardized scoring tools like the Morse scale. Patients designated as a falls risk are highlighted in electronic health records and carry physical reminders such as yellow blankets, socks, and sometimes room signage or bracelets. Education is provided to patients and visitors about the need to call for help before getting out of bed. And, where possible, patients may also be given a bed or chair alarm to notify staff if a patient gets up without assistance. These standard care bundles are helpful, but not always enough. Even with the standard bundles, falls still happen. Thousands of falls happen each year, with 30 to 50% resulting in injury. Falls of older adults alone cost the hospital system $34 billion in direct medical costs per year. Litigation and other indirect costs can increase this number. Falls result in further injury to vulnerable patients and increased lengths of stays, on average 6.3 days, according to the Joint Commission. Falls continue to happen because yellow socks may be covered by blankets, or yellow blankets may be hidden in the bed. Patients may have difficulty learning and therefore are unable to retain or implement instruction to call for help. Or they may feel burdensome or that their needs are too urgent. In-room alarms may be difficult for nurses or staff to hear from out in the hall or in another patient's room. And even overhead alarms may become routine and indistinguishable from the plethora of alarms on a hospital floor. The Joint Commission estimates that 85 to 99% of these alarm signals do not require clinical intervention. Most hospital beds have weight-based alarms which set off any time a patient moves. Sometimes it can turn off with a slight movement, while other times it turns off too late. Video monitoring allows nurses to see when the patient gets off or attempts to get off, allowing nurses to have advance warning. The addition of video monitoring to an implemented fall prevention program helps to decrease falls in patients who show impulsive behavior. Replacing one-to-one sitters, video monitoring showed a cost-effective improvement in safety for patients that are confused and impulsive.
Josephine, stay in bed.
I'm just trying to get to my phone.
Okay, use your call light if you need something you can't reach.
These new technologies have various levels of impact on the ability of a hospital to reduce falls. Evidence shows that video monitoring and reducing unnecessary alarms significantly reduces falls, protects patients, reduces hospital costs, and helps nurses focus on important tasks. New technology, in addition to standard bundles, can produce an average savings of $1 million annually for a typical 200-bed hospital.
falls prevention
Deserves your attention.